Hello, welcome to the PARS Health TV channel. We hope you're having a good day and you are happy and healthy. In this channel, we give you tips to keep you healthy and out of trouble. In this video, we want to talk about basic spine anatomy. If you haven't watched the first part of the basic spine anatomy video yet, please check out the previous video. This video is for educational purposes only, and if you have any specific condition or illness, you should consult with your doctor. The spine is one of the most important parts of your body. Without it, you could not keep yourself upright or even stand up. It gives your body structure and support. It allows you to move about freely and bend with flexibility. The spine is also designed to protect your spinal cord. The spinal cord is a column of nerves that connects your brain with the rest of your body, allowing you to control your movements. Without a spinal cord, you could not move any part of your body, and your organs could not function. This is why keeping your spine healthy is vital if you want to live an active life. The spine is a very complex mechanical structure that is highly flexible, yet very strong and stable. In a normal spine, regardless of your position or activity, including sleeping, there is always some type of physical demand being placed on it. The primary functions of the spine include protecting the spinal cord, nerve roots, and internal organs, providing the flexibility of motion, providing structural support and balance for upright posture. The spine bears the load of the head, shoulders, and arms, and upper body. The upper body weight is then distributed to the hips and legs. The spine attempts to keep the body's weight balanced evenly over the pelvis. This reduces the amount of work required by the spinal muscles and can eliminate muscle fatigue and back pain. The normal adult spine is balanced over the pelvis, requiring minimal workload on the muscles to maintain an upright posture. Loss of spinal balance can result in strain to the spinal muscles and deformity of the spine as it attempts to maintain an upright posture. If you like topics like this, make sure to subscribe to our channel and press the bell icon to see daily videos just like this one. Alright, let's get started. Here we explain the basics about spinal anatomy to help you understand your back or neck pain, the doctor's diagnosis and treatment plan, and 10 steps you can take today to help prevent a spine problem. Spine movement enablers and stabilizers, discs, facet joints, ligaments, muscles. The spinal column doesn't consist only of bones. To maintain its double S shape, provide skeletal support and route the nerves where they need to go, the spine also relies on many supporting structures. First among these structures are the spinal discs, called intervertebral discs. Each disc is similar to a fibrous pad of tissue, called fibrocartilage, and anchored in place by vertebral end plates, called cartilaginous end plates, starting at C3 through L5 sacrum. These discs act as interbody spacers and shock absorbers. Notably, there is no spinal disc between C1 and C2, nor is there a disc between the sacrum and the coccyx. Facet joints are paired, left and right sides, at the back of each vertebral body, C3 to L5. Sometimes these joints are called zygapophyseal or apophyseal joints. These joints help stabilize the spine while allowing flexion, bending forward, extension, bending backward, and twisting movement, called articulation. Similar to other joints in the body, each facet joint is encased in a capsule of connective tissue that produces a nourishing fluid that lubricates the joint. Cartilage coats the joint surfaces, ensuring smooth movement. Different types of spinal ligaments, strong, tough bands of tissue, connect the vertebrae, discs, and facet joints to help stabilize and support the spinal column at rest and during movement. The ligaments act like stretchy-like tension cords that allow the spine's bones, discs, and joints, facet joints, to move within a limited range. And, of course, small and large spinal muscles and tendons help stabilize and strengthen the vertebral column while supporting and limiting extreme bending, flexing, and twisting movements. Vertebral column protects the spinal nerves. The vertebral column serves to protect the spinal cord and nerve roots, which are part of the central nervous system that starts at the base of the brain. The vertebral structures form a continuous round hollow space that houses the spinal cord from the cervical through the lumbar spine. Small nerve roots branch off from the spinal cord and exit the vertebral column through the foramen, also called foramina or neuroforamen. Each foraminal space is created on the left and right sides of an intervertebral disc, which is anchored between two vertebral bodies. After the nerve root exits the spinal column, it branches out into the peripheral nervous system, which serves the entire body head to toe. Near L1 in the sacrum, the spinal cord ends and becomes a fan-like wisp of nerves called the cauda equina, resembling a horse's tail. Vertebral column and spinal nerves. If you envision the spinal canal as an interstate highway, you can imagine the foramen as highway exits. Each set of spinal nerves exit the spinal canal through the foramina associated with a particular part of the body that the nerve system supports. Nerves enable the function, motor, and feeling, sensation. For example, the nerves that provide sensation to the fingers exit the spinal canal via foramina in the cervical spine, because that segment is located nearest the hands. Spine specialists have a deep understanding of the nervous system, including the cause and effect of spinal disorders. The patient's description of their symptoms coupled with a physical and neurological examination help the spine doctor diagnose the problem, for example, sciatica, and its cause, for example, herniated disc. Here are parts of the body associated with regions of the spinal column. Cervical spine, diaphragm, breathing, shoulders, parts of the arms, esophagus, part of the chest. Thoracic spine, parts of the arm and esophagus, trachea, heart, lungs, liver, gallbladder, small intestine. Lumbar spine, legs and feet. Sacrum, bowel, bladder, sexual function. 10 spine care prevention tips. It's never too late to implement lifestyle changes to help reduce your risk of developing a spinal disorder. Even some accidents may be preventable. These 10 spine care tips can help get you started. Always wear your seatbelt. Adjust your seat so there are 10 inches between you and your airbag. Fall-proof your home by removing throw rugs you could slip on. Clear hallway floors of clutter. Make sure stairways are well lit. Use a non-skid rubber mat in the shower. If you smoke or vape, now is the time to stop. If you need to lose weight, even losing 10 pounds can help reduce lower back pain. Avoid heavy drinking of alcoholic beverages. Make good posture a habit. Don't sit all day. Periodically get up, stretch and move around. Eat a healthy diet. Talk with your doctor about supplements, for example, vitamin D, calcium. Learn your T-score and osteoporosis risk. Regular exercise, stretching, yoga, Pilates, aerobics, mix it up with your doctor's guidance. Your spine is a complex structure of small bones, vertebrae, cushioning discs, nerves, joints, ligaments, and muscles. This part of your anatomy is susceptible to injury, arthritis, herniated discs, pinched nerves, and other problems. Back pain can affect your ability to enjoy life. Your healthcare provider can help ease back pain and offer suggestions to strengthen the muscles that support your back and prevent back injuries. Strong back muscles can protect your spine and prevent back problems. Try to do back strengthening and stretching exercises at least twice a week. Exercises like planks strengthen the core, abdominal, side, and back muscles to give your spine more support. Other protective measures include: bend your knees and keep your back straight when lifting items. Lose weight, if needed. Excess weight strains your back. Maintain good posture. If you are interested in videos like this, make sure to like this video and subscribe to our channel. We hope you have a wonderful day. See you in the next video.